Hi friends, hello, good morning, welcome to our channel The Voice of Nurse. Today we are going to discuss a continuous topic from the previous video, model paper for staff nurse 2023. In previously we discussed part 1 related to the model paper of staff nurse 2023. So here this is not only MHSRB purpose, we can prepare these model papers for all competitive exams also, and also this is set 2. Set 1 already finished 2 months back only model paper. I will give a link in description. Please check it once friends. Before today topic discussion, a small request friends. Anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification, and please share the video to your friends and share your opinion in comment section. Give a like and share the video. Please watch full video, don't skip and don't stop video. All questions are very important questions. Let's move on to today's class. Question number 31. Till 30 we already discussed in part 1. Today we are going to discuss part 2 related to the staff nurse exam model paper. 31 question. Colon wash also known as. Here colon wash is also known as. We will see here options. Option A, colon irrigation. Option B, hydrotherapy. Option C, colonic cleansing. Option D, all of the above. Colon wash also known as colon irrigation, colon hydrotherapy and colonic cleansing. So here all of the above is the correct answer. Is the treatment which is used to wash out contents of the large bowel by means of copious enemas using water or other medication. The purpose of colon wash or colon irrigation is to expel fecal fluid buildup and mucus plaques and removes harmful bacteria and leaves client feeling revived and lighter. The colon wash procedure claimed to have a various health benefits. So, colon wash involves using water to flush out waste of the intestine. Here, colon wash is also called as colon irrigation, hydrotherapy and colonic cleansing. So here all of the above is the correct answer. Next we will move on to question number 32. Which pressure is present in the lungs? Which pressure is present in the lungs? We will see here options. Option A, positive. Option B, negative pressure. Option C, tidal volume. Option D, PEEP. Here the lung have positive pressure during exhalation and negative pressure during the inhalation. So we are having the positive and negative pressures in the lungs, but there is always a slightly negative pressure within the thoracic cavity, which aids in keeping the airways of the lungs open during inhalation. Volume increases as a result of contraction of the diaphragm and pressure decreases according to Boyle's law, although it fluctuates during inspiration and expiration. Intrapleural pressure remains approximately 4 mmHg throughout the breath cycle. So, which pressure is present in the lungs means negative pressure only. Here actually we are having positive pressure during the exhalation, negative pressure in the inhalation, but always slightly negative pressure which is present in the thoracic cavity. That's why negative pressure is the correct answer here, option B. Next we will move on to question number 33. How you will identify the sensitivity of the drug? How you will identify the drug sensitivity? We will see here options. Option A, test dose. Option B, lethal dose. Option C, IV dose. Option D, none of the above. A sensitivity analysis is a test that determines the sensitivity of bacteria to an antibiotic. It also determines the ability of the drug to kill the bacteria. Drug intolerance or drug sensitivity refers to an ability to tolerate the adverse effects of a medication, generally at therapeutic or subtherapeutic doses, we can see here the generally the therapeutic or subtherapeutic doses we can give by through the test dose. So here how you will identify the sensitivity of drug means here option A test dose is the correct answer. After in case we are not giving test dose means we will receive some of the allergic reactions some of the patients. In case patient is not tolerate the drug, then patient will develop some of the reactions, transfusion reactions like side effects, rashes, fever, nausea, vomiting, cough, diarrhea and headaches, and sometimes patient will develop SOB, shortness of breath also. So test dose is the must and for most important before administering a therapeutic or subtherapeutic doses. So here how you will identify the sensitivity of the drug means option A test dose is the correct answer here. Next we will move on to question number 34. Patient is with cholera. Stool findings are here patient is having cholera. Stool findings are, we will see here options. Option A green, option B normal, option C rice water, option D none of the above. Here what is cholera? We have to know. A bacterial disease causing severe diarrhea and dehydration usually spread in water is called as cholera. Cholera means it is a bacterial disease causing severe diarrhea and dehydration. Usually it will spread in water. The symptoms of cholera we will see now. The symptoms of cholera infection can include cholera related diarrhea comes on suddenly and quickly cause dangerous fluid loss as much as a quarter means about 1 liter in a hour. Diarrhea due to cholera often has a pale milky appearance that resembles water in which rice has been raised. Means here the cholera stools findings are like rice water. So here option C is the correct answer. Patient is having cholera. The stool findings like rice water. So here option C is the correct answer. Next we will move on to question number 35. Which of the following is method of inventory control in which the items are classified on the basis of rate consumption? According to classified by basis of rate consumption, the method of inventory control from the following. We will see here options. Option A ABC analysis, option B VAD analysis, option C FSN analysis, option D HML analysis. Here the method of inventory control in items are classified and basis rate of consumption is FSN analysis. FSN analysis is an inventory management technique. It is an important aspect in logistics. The items are classified according to their rate of consumption. FSNF means here what is the meaning of FSN analysis means F means fast moving, S means slow moving, N means non moving. So here FSN means fast moving, slow moving, non moving. Essentially this segments inventory into three classification. It looks at quantity, consumption rate and how often the item is issued and used with ABC analysis to help inventory managers. Here FSN means fast moving, slow moving and non moving. Here in this following option method of inventory control in which item is classified and basis of rate consumption is option C FSN analysis is the correct answer here. Next we will move on to question number 36. Cold dirt causes. Cold dirt will cause. We will see here options. Option A silicosis, option B bagasosis, option C A and B, option D anthracosis. See one by one. What is silicosis? Silicosis inhaling large amounts of crystalline silica dust. Silicosis is caused by the inhaling large amounts of crystalline silica dust. It is a lung disease. Next option B bagasosis. Bagasosis is an airborne disease caused by inhalation of fibrous cane sugar residue. Bagasos is inhalation of fibrous cane sugar residue. Option C, A and B. Next, option D, anthracosis. Anthracosis is caused by inhalation of coal dust. So here option D is the correct answer. Coal dust causes the anthracosis. Here, caused by inhalation of coal dust, deposition of dust produces dust-laden macrophages around bronchioles, occasionally causing focal bronchial emphysema due to the accumulation of carbon in the lungs due to repeated exposure to air pollution or inhalation of smoke or coal dust particles. So here option D is the correct answer. Coal dust is causes the anthracosis. Anthracosis is also called as black lung disease. Anthracosis is also known as black lung disease or coal worker pneumoconiosis. Coal worker pneumoconiosis is also called as anthracosis. Here option D is the correct answer. Next we will move on to question number 37. The theory of psychoanalysis was presented by. The theory of psychoanalysis was presented by. So here we will see options. Option A, Sigmund Freud. Option B, Undit. Option C, Gidding. Option D, Weber. The founder of psychoanalysis is Sigmund Freud. Was born in Australia and spent most of his childhood and adulthood life in Vienna. Theory suggests that human behavior is influenced by unconscious memories, thoughts. This theory was also proposes that the psycho comprises the three aspects are ego and superego. So here the theory of psychoanalysis was presented by the Sigmund Freud. So here option A is the correct answer, Sigmund Freud. Next we will move on to question number 38. A nurse can decontaminate the HIV contaminated waste products with all following except. So here nurse can decontaminate the HIV contaminated waste products with the following except option. We will see here options. Option A, sodium hypochlorite. Option B, methanol. Option C, formaldehyde. Option D, glutaraldehyde. Sterilization is a process that removes, kills or deactivates all forms of microorganisms or all forms of life and other biological agents or all living microorganisms and spores. The types of sterilization is physical method and chemical method. Physical method. In physical method, the physical methods like sunlight, dyeing, heat and radiation. Here the heat, physical method of heat is having two types, dry heat and moist heat. In dry heat, flaming hot air oven incineration. In moist heat we are having boiling, autoclaving and pasteurization of milk. We are having these many things. Here chemical, here we are having sterilization, physical and chemical. Next we will see chemical. In chemical, alcohol, aldehydes, formaldehyde, glutaraldehyde is there. So here the sodium hypochlorite is used as a disinfecting agent. Methanol is used as a plastics, paints, car paints and constructions of materials. So here the nurse can decontaminate the HIV contaminated waste products with the following except means here option B, methanol is the except here. Next we will move on to question number 39. Client is an undergoing of CVC. Nurse has to know which vein to be used. Here the client is using undergoing for a CVC line, central venous catheterization. CVC means central venous catheterization. The nurse has to know which vein to be used. We will see here options. Option A, subclavian vein. Option B, radial vein. Option C, cephalic vein. Option D, brachial vein. It is recommended that the subclavian or internal jugular vein, subclavian or internal jugular vein are used for short-term non-cuffed CVC and the femoral vein is only used where chemically indicated. So here the subclavian vein, subclavian vein is usually below the right collarbone, guided into a large vein above the right side of the heart is called as the superior vena cava. The subclavian vein is one of the most common site for central line placement. So here option A is the correct answer. Client is undergoing a central venous catheterization. The nurse must have to prepare subclavian veins. Option A is the correct answer. Here next we will move on to question number 40. After death, rigor mortis takes place within. After the death, rigor mortis takes place within. We will see here options. Option A 10 hours, option B 12 hours, option C 6 hours, option D 4 hours. Here what is rigor mortis? Rigor mortis is a post-mortem changes resulting in the stiffening of the body muscles due to a chemical changes. The rigor mortis appears approximately 2 hours after the death in the muscles of the face, progresses to the limbs over next few hours, completing between 6 to 8 hours after the death. Rigor mortis, three types: rigor mortis, livor mortis and algor mortis. What is rigor mortis? We know. Rigor mortis is a post-mortem changes resulting in the stiffening of body muscles due to the chemical changes. What is livor mortis? Livor mortis is also called as hypostasis. Livor mortis is the pulling of the blood in the body due to gravity and lack of blood circulation as a result of cessation of cardiac activity. These factors cause the blood to pull in the lowest point of the body, giving the skin purplish red discoloration. This is livor mortis. Next, third one is algor mortis. Algor mortis is also called as cold death. Algor mortis is translated from Latin word cold death and describes post-mortem temperature change after some has died. After death, individual no longer produce body heat or cooling mechanisms and decided temperature slowly approaches in the ambient temperature. So here after death, rigor mortis takes place 6 to 8 hours after the death. So here option C is the correct answer. Next we will move on to question number 41. Census is done every. Here we will see options. Option A 5 years, option B 6 months, option C 10 years, option D early. Census is done in every how many years? With the history of more than 130 years, this reliable time tested exercise is bringing in real insight into a data every 10 years. Beginning in the year 1872, when the first census was conducted non-synchronously in different parts of India. The last census was conducted in the year of 2011. Here, who was Census Commissioner in India means the father of Census Commissioner in India under the leadership of W.C. Plowden. So here option C 10 years is the correct answer. Here father of census in India under the leadership of W.C. Plowden. He is Census Commissioner in India. Next we will move on to question number 40. The triple assessment includes all except. Triple assessment test includes all except from the following. We will see here options. Option A FNAC, option B bone scan, option C mammography, option D physical examination. Triple assessment, as the name indicates, includes three modalities. Includes physical examination, imaging, mammography or ultrasonography, and biopsy like FNAC and core biopsy. Here option D is the except. Here triple assessment test includes three modalities: physical examination, mammography or ultrasonography, biopsy like FNAC. FNAC means fine needle aspiration. So here for example, for the triple test refers to three diagnostic components like medical history and clinical breast examination, needle aspiration cytology for FNAC means fine needle aspiration cytology. So here option B is the except bone scan. Triple assessment test means option A, B, C. FNAC, mammography or ultrasonography, and option D, physical examination and or medical examination also. So here option B is the except here. Next we will move on to question number 43. Rural term derived from. The word rural term is derived from. We will see here options. Option A, Spanish. Option B, Latin. Option C, Sanskrit. Option D, none of the above. The word rural descends from Middle English from Old French. The word derived from Latin ruralis. Rural means relating to country areas as opposed to large towns. Rural was first used by the Census Bureau in year of 1874 when it was defined as population of a country living outside cities or towns with 8,000 or more inhabitants. It generally says that the rural areas house up to 70% of India's population. So here the rural term is derived from the English, Middle English from Old French. The word from Latin word ruralis. So here option B, Latin is the correct answer. Rural word is derived from Latin word. Next we will move on to question number 44. The daily requirement of vitamin A. What is the daily requirement of vitamin A? We will see here options. Option A, 750 mcg. Option B, 1600 mcg. Option C, 900 mcg. Option D, 1100 mcg. The daily recommended amount of vitamin A is 900 mcg, 900 micrograms for adult men, and in adult women 700 micrograms. According to the gender and age, we are having the daily requirement of vitamin A. So here the recommended daily amount of vitamin A is in adult men 900 micrograms, in adult women 700 micrograms. We will see according to the age wise. Age of 9 to 13 years. The age of 9 to 13 years, the requirement of vitamin A in male and female is 600 micrograms only. And age of 14 to 18 years, the daily requirement of vitamin A is 900 micrograms in men, 700 micrograms in female. The age of 19 to 50 years, requirement of vitamin A 900 micrograms and 700 micrograms in female. 900 micrograms in male, 700 micrograms in female at the age of 19 to 50 years. 19 to 50, 19 to 50 years, and 51 plus years. The requirement of vitamin A in males 900 mcg and in females 700 mcg. The vitamin A deficiency signs and symptoms like dry skin, dry eyes, night blindness, infertility, delayed growth, poor wound healing, acne. So here mangoes is known as a king of fruits and also excellent source of a vitamin A, vitamin C, minerals and fibers. So here the daily requirement of vitamin A is option C, 900 micrograms is the correct answer here. Next we will move on to question number 45. Lack of oxygen in tissues. Lack of oxygen in tissues. We will see here options. Option A, anoxia. Option B, asphyxia. Option C, cyanosis. Option D, anoxemia. We will see one by one. Option A, what is anoxia? Anoxia is a state of total oxygen deprivation in with the tissues or organs. It is an extreme form of hypoxia, a condition characterized by insufficient availability of oxygen in tissues. For example, stroke and also heart failure. So here lack of oxygen in the tissues is called as anoxia. So here option A is the correct answer. Next we will see other medical terms also. What is asphyxia? Asphyxia is a condition arising when the body is deprived of oxygen, causing unconsciousness or death. Example, choking. Next option is cyanosis. Cyanosis is bluish or grayish color of the skin, nails, lips or around the eyes is called as cyanosis. Example for the cyanosis is peripheral cyanosis. Option D, anoxemia. Option D, anoxemia is the severe reduction and absence of oxygen in the arterial blood. This condition can result in lack of consciousness and brain damage. For example, for the anoxemia is brain damage or unresponsiveness. So here lack of oxygen in the tissues is called as anoxia. Option A is the correct answer here. Next we will move on to question number 46. A break in the continuity of bone is called as. A break in the continuity of bone is called as. We will see here options. Option A, fracture. Option B, injury. Option C, swelling. Option D, trauma. A partial or complete break in the continuity of bone, any bone is in the body called as fracture. So, a break or a partial or complete break in the continuity of any bone in the body is called as fracture. Fractures range from small partial cracks to complete breaks and can occur in any bone. The types of fractures like green stick fracture, transverse fracture, committed fracture and spiral fracture, compound fracture and oblique compression fracture, stretch fractures. Here a break in the continuity of bone is called as fracture. A break of partial or complete break in the continuity of any bone in the body is called as fracture. So here in these options, option A is the correct answer. Next we will move on to question number 47. Thermometer was discovered by. The thermometer was discovered by. We will see here options. Option A, Carrison. Option B, Clement. Option C, Galileo. Option D, Fahrenheit. Here Galileo invented a rudimentary water thermometer in the year of 1593, which for the first time allowed temperature variations to be measured. In the year of 1714, Gabriel Fahrenheit invented the first mercury thermometer, the modern thermometer. That was modern thermometer. According to the biographer Vivani, writing in 1718, Galileo invented a thermometer around the time he has made chair of mathematics at Padua University in late 1592. The thermometer was discovered by Galileo Galilei. Here the name was Galileo Galilei invented the rudimentary water thermometer in the year of 1593. So option C, Galileo is the correct answer. His name is Galileo Galilei. Next we will move on to question number 48. Inflammation of the tongue. What is the inflammation of the tongue is called as? We will see here options. First option A, otitis. Option B, cheilitis. Option C, chelosis. Option D, glossitis. We'll see one by one. Option A, otitis. Otitis is a inflammation and infection to the middle ear. Otitis media is an infection of the middle ear that causes inflammation and a buildup of fluid behind the eardrum. Causes like bacterial infection. Next we will see option B, cheilitis. Cheilitis is an inflammation of the lips. Acute or chronic inflammation of the lips causes may include irritated skin, allergies, frequent sun exposure, infection and anti-immune conditions. Fungal inflammation is the most common cause of the angular cheilitis. Next we will see option C, chelosis. Inflammation and small cracks in one or both corners of the mouth. Causes of chelosis: excessive moisture and saliva collecting at corners of mouth, followed by secondary infection with Candida albicans or Staphylococcus aureus. Next we will see option D, glossitis. It is a condition in which inflammation of the tongue becomes inflamed and swollen. Causes of glottitis is allergic reactions, infections and dry mouth, trauma, GERD, autoimmune diseases or rare disorders related to the glossitis can be presenting symptoms of more serious symptomatic conditions. So here inflammation of the tongue is called as option D, glottitis. So here option D is the correct answer. Next we will move on to question number 49. The first set of milk teeth appear at which age? Here the first set of milk teeth will appear which of the age following? We will see here options. Option A 4 months to 10 months, option B 3 months to 9 months, option C 6 months to 12 months, option D 9 months to 20 months. Most babies will develop teeth between the 12 months, 6 to 12 months. Many parents question whether or not this means that their babies is teething, but their first tooth usually appears around the 6 months old. So milk teeth appears at 6 months to 12 months, and afterward the other teeth begin to erupting in a age of 6 years. The first permanent molar teeth will erupt. The first teeth begin to break through their gums at about 6 months of age to 12 months of age. It is different to every individual kid because depending upon the healthy status and immunity, depending upon these all things, development will happen. So here the first set of milk teeth appears in the age of between 6 to 12 months. So here option C is the correct answer. Next we will move on to question number 50. Marble bone disease is better known as. The marble bone disease is also known as. We will see here options. Option A osteoporosis, option B osteochondritis, option C osteopetrosis, option D none of the above. What is marble bone disease? What is meant by marble bone disease? We will see. Marble bone disease is a rare skeletal disorder due to the defective function of the osteoclast. Marble bone disease is better known as osteopetrosis. Osteopetrosis is a group of rare disorders that cause bones to grow abnormally and become orally dense. Here, osteopetrosis is literally stone bone, also known as marble bone disease, described in 1904 by Albus Schoenberg. So it is also called as marble bone disease because of the dense bones observed by X-ray. Marble bone disease is also called as osteopetrosis and also called as Schoenberg disease. So here option C is the correct answer. Next we will move on to question number 51. Man is intermediate host of. Man is the intermediate host of. We will see here options. Option A malaria, option B dengue, option C plague, option D filaria. The intermediate host of malarial parasites is a mosquito of genus Anopheles that can infect humans and other mammals. Man is the intermediate host of the malaria parasite. Man is the characterized by mainly the protozoan parasite Plasmodium. Intermediate host of the malarian parasite is the man mosquito larva of mosquito. So here option A is the correct answer. Man is the immediate host of malaria. So here option A is the correct answer. Next we will move on to question number 52. ELISA technique was first introduced by. ELISA technique was first introduced by. We will see here options. Option A Ingval Perelman, option B Davidson, option C Tiselius and Longsworth, option D none of the above. Here ELISA means enzyme linked immunosorbent assay, or EIA means enzyme immunosorbent assay. So here ELISA technology and EIA also used same technology. EIA means enzyme immunosorbent SI. Here, in the year of 1971, Eva Ingvall and Peter Perlman invented the method that revolutionized medicine called as ELISA test. The method used antibodies to seek out the presence of hormones or viruses. ELISA is a plate-based assay techniques designed for detecting and quantifying soluble substances such as peptides, proteins, antibodies, and hormones. So here ELISA technique was introduced by option A, Ingvall and Perlman. Ingvall and Peter Perlman is the correct answer here. Next we will move on to question number 53. Which of the following scale of measurement has an absolute zero? Here, which of the following scales measures has absolute zero? We will see here options. Option A, nominal. Option B, ratio. Option C, ordinal. Option D, interval. Temperature measured in Kelvin is an example. There is no value responsible or there is no value possible below the 0 degree Kelvin. It is an absolute zero. A ratio scale is a scale that processes absolute rather than relative qualities. It has an absolute 0 point. So here, which of the following scale measurements has an absolute zero means here option B, ratio. So here option B, ratio is the correct answer. Next we will move on to question number 54. Here neonate touching by the nose to the cheek near of the mouth, then neonate turning of head towards the stimulation is known as. Here the neonate is there in the word. The nose is touching by the neonate at the cheek near of the cheek mouth. Then neonate will turn the head towards the stimulation is known as. We will see here options. Option A, Moro reflex. Option B, rooting reflex. Option C, sucking reflex. Option D, plantar reflex. Here what is the reflex? We will see one by one. Moro reflex. Moro reflex is an involuntary protective motor response against abrupt destruction of body balance. Here example for the Moro reflex is extremely sudden stimulation of the body. It is a Moro reflex. Next we will see rooting reflex. Rooting reflex is an innate response of head due to the stimulation of the face, mouth or cheek by touching. It is transmitted by the following. Here what is sucking reflex? We will see. Sucking reflex is said to be seen in utero by the 3rd month of fetal life. When the roof of the baby's mouth is touched, the baby will start sucking. This is called as sucking reflex. Option D, plantar reflex or Babinski reflex occurs after the sole of the foot has been firmly soaked. The big toe then moves upwards or towards top surface of the root. The other toes then fan out. So here neonate touching by the nose to the cheek near the mouth. The baby or neonate turning of head towards the stimulation is known as rooting reflex. So here option B is the correct answer. Next we will move on to question number 55. Question number 55. Chemical name of the thiamine. What is the chemical name of the thiamine? We will see here options. Option A, vitamin B12. Option B, flavin. Option C, anurine. Option D, none of the above. Here what is thiamine? Thiamine is a soluble in water, insoluble in alcohol. So thiamine is a water soluble vitamin. It is insoluble in alcohol. And also thiamine is also known as vitamin B1 is a colorase compound with the chemical formula C12H17N4 and O S. Thiamine is found in both plants and animals and plays a clinical role in certain metabolic reactions. B vitamin that prevents beriberi, maintains appetite and growth. So here thiamine is also called as vitamin B1 and anurine. So here option C, anurine is the correct answer. Next we will move on to question number 56. Sterilizing agent is. The sterilizing agent is from the following. We will see here options. Option A nitrogen, option B carbon tetrachloride, option C oxygen, option D ethylene oxide. It is used primarily to produce other chemicals including antifreeze in smaller amounts. Ethanol oxide is used as a pesticide and a sterilizing agent. The ability of ethylene oxide to damage DNA makes it an effective sterilizing agent but also accounts for its cancer causing activity. So here ethanol oxide is the most commonly used agent in chemical sterilization because it is a gas. It rapidly penetrates packing in items to be sterilized. Ethanol oxide is an effective sterilizing agent, bacteriological broths, milk and serum. So ethanol oxide potent and highly penetrating alkylating agent. So here these characteristics make it an extremely effective sterilizing agent. So here in these options the sterilizing agent is option D, ethanol oxide. Option D is the correct answer here. Next we will move on to question number 57. Which of the following curriculum is known as problem solving curriculum? Here in this option is the problem solving curriculum. We will see options. First option A co-relational curriculum, option B integral curriculum, option C core curriculum, option D basic curriculum. Here problem solving curriculum means problem solving is a ability of students to make choices, interpret, formulate, model and investigate problem situations, select and use technological functions and communicate solution effectively. Students pose and solve problems when they use mathematics to represent unfamiliar or meaningful situations. Here, which of the following curriculum is known as problem solving curriculum means correlational curriculum. Correlated curriculum is a style of curriculum arrangement that emphasizes the unique aspects of each area of study while demonstrating relationships across disciplines. Example for the correlated curriculum is includes in biochemistry, which is the combining of biology and chemistry. This is best example for the correlated curriculum. Biochemistry, which is included combining of biology and chemistry. This is correlated curriculum. So here problem solving curriculum is also called as correlational curriculum. Option A is the correct answer. Here next we will move on to question number 58. Infective hepatitis virus is present in. The infective hepatitis virus HPV hepatitis virus is present in which of the following options? We will see here options. Option A sputum, option B saliva, option C blood, cold, dirt, option D all of the above. The hepatitis virus is present in saliva of people with hepatitis B can contain the hepatitis B virus but in very low concentration compared with blood. Infections of infected saliva can transmit the viruses. So, bite injuries can also spread the diseases. Hepatitis A from saliva. So, here saliva is infected hepatitis virus and also hepatitis B virus is transmitted through the exposure to the infective blood, semen and other body fluids. Here infective hepatitis virus means here will come hepatitis viruses, all hepatitis viruses. Hepatitis A, hepatitis B, hepatitis C, hepatitis, all viruses will come here. So infective hepatitis viruses is present in all of the above. Here option D is the correct answer. Infective hepatitis virus is present in sputum, saliva and blood, cold dirt and blood, semen and body fluids also. So here all of the above is the correct answer here. Next we will move on to question number 59. Intraosseous means, what is meant by intraosseous? We will see here options. Option A, drugs or fluids introduced into bone marrow. Option B, drugs introduced into IV. Option C, drugs or fluids introduced into intramuscular. Option D, none of the above. Intraosseous or vascular access refers to the placement of a specialized hollow bore needle through the cortex of a bone into the medullary space for infusion of medical therapy and laboratory tests. The intraosseous route is an option when standard venous access would delay therapy or is not easily obtained in the therapies. Intraosseous infusion is used in instances such as immediate indication or life-threatening emergency, cardiac or respiratory arrest, acute shock, hypothermia, obesity, edema, thermal injury. These all are the emergency conditions for introducing the intraosseous injection. What is meant by intraosseous medical terms? Situated within, occurring within or administering by entering a bone. So here intraosseous means drugs or fluids introducing into the bone marrow. So here option A is the correct answer here. Next we will move on to question number 60. This is last question in this part 2 related to the model paper. Question number 60. The drugs used for the steam inhalation. Which drugs we can use for the steam inhalation from the following? We will see here options. Option A, menthol. Option B, benzyne. Option C, tincture. Option D, all of the above. Steam inhalation with carbolplase tablet is a tablet manufactured by Indico Medmis Limited. It is commonly used for diagnosis of treatment of nasal congestion, cold sores, common cold, asthma and cough. But here in the steam inhalation, drugs is used in the following. Use ordinary water just boiled from the kettle. You do not need to add anything. Some people choose by electrical steam inhaler also. But primarily medical effects that home therapy is used symptoms, illnesses, cause congestion, runny nose and sore throat. The common cold also we can use for the steam inhalation, like Vicks personal steam inhaler and Gurun personal steam inhalers and Verin's inhalers. These all are the inhalers types of inhalation. Menthol, benzyne, tincture, these all things we can use for the steam inhalation purpose. So here all of the above is the correct answer. Tincture, benzyne, menthol and camphor and also eucalypt patches also we can use for the inhalation. So here all of the above is the correct answer. The drugs is used for the steam inhalation means all of the above is the correct answer here. This is last question in this part 2 related to the model paper for staff nurses. This is part 2. We already discussed part 1 in first to 30 question. In part 2 we discussed 30 to 60 questions. This is second set of model paper. We already discussed in set 1. This is second set. We finished 60 questions successfully. So thank you so much for watching my video. Anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification and please share your opinion in comment section. Please like a video and share the video to your friends. Stay tuned, keep watching friends. Thank you.